Hey everybody, happy Friday. Welcome to another Friday Lunch and Learn with me. I'm really excited for today's guest. Dr. Weber is an OBGYN and she is going to be talking to us today about why pap smears are so important, why I bug you guys so much about those before we start treatment. So a couple announcements just as we're getting started. Number one, if you have not signed up for the weekly newsletter, please be sure to do so now. The registration for the free PCOS Masterclass will be coming through that newsletter. So please go ahead and sign up if you haven't already. Which leads me to point two, the PCOS Masterclass, a free webinar, free 1 hour with me. That will be happening Monday, February 27th. Registration is required. It will be via Zoom. It will not be here on Instagram. So you want to make sure that you go ahead and register for that. It will be at 12 p.m. Pacific, but if you register and can't make it, you will be getting a replay, so be sure to do that. And number three, if you haven't already, check out my YouTube channel, Dr. Carolina Sweldo, and let me know what you think, okay? I believe Dr. Weber, give me 1 second, guys. Accept.
Hello.
There we
Hi.
go. Hello.
I'm good. How are
How are
you?
you? Good. I'm so excited to have you
Oh,
here
thanks
today. Thank you so
for
much
having
for
me. I
joining
appreciate
me.
it.
So, Susie, before we get started, I do just want you to go ahead and introduce yourself to my audience. I did mention you are Dr. Weber, you're an OBGYN, and I'm going to let you fill in the rest
Okay, yeah, I'm
before we get
Dr.
started.
Suzanne Weber. I go by Susie. I'm a board certified gynecologist. I'm practicing in the South Denver area. I take care of women of all ages, but I am also a certified menopause specialist and have a um, website where I blog and offer coaching to perimenopausal menopausal women.
So, just out of curiosity, what sparked your interest in menopause to
You
get
know,
certified?
that's a good question. I think I've been in practice about 20 years, and so there have been a lot of changes. I trained right before the Women's Health Initiative study came out, and
Mm-hmm.
I don't know, just I've always sort of been drawn to that. And I guess now, as a menopausal woman, I just feel like I'm going through a lot of that same stuff with my patients. So, yeah, kind of.
Sure. And what can you tell my audience what's the difference between coaching and seeing you in
Right.
your
So
South Denver
I'm
office?
an employed physician, so I see patients in a group practice. So that would be medical, that would be medical care with potentially prescriptions and things like that. And then on my through my web page, it's more coaching or consulting, just talking and educating and not necessarily developing a treatment plan. And there's no prescribing of medications.
Yeah. And I think coaching, it was new to me in the last year, I have to be honest, but has been really life changing. And so I think it's a concept that's fairly new to most people. It certainly was new to me as of a year ago, but has really sort of up leveled my life and my quality of life. So you are very needed. And the perimenopausal space, I think, finally is starting to get some much deserved attention. So I'm hoping that that wave doesn't just fizzle. And I hope that we're able to provide those services for women in that age range. So, I want to talk to you as a gynecologist about cervical cancer screening. And so people, a lot of times I think as women, we are socialized and brought up, oh, pap smear, pap smear, pap smear. But I don't think a lot of women actually know what a pap smear is or
Yeah.
what we're looking for. So I really wanted to start, and I know for you this is like super basic, but I really wanted to start just at the
Right.
baseline and
Actually,
kind of
that
build
was on
from
my list
there.
of things to talk about because I think there is confusion about what is a PAP, what is a pelvic exam. A lot of times women will go into the ER, they'll go somewhere and they get a pelvic exam and they think that they had a PAP. And that's just not true. So a pap smear is the screening test that we collect during a pelvic exam to check for cervical precancers or cancers. And that's generally going to be performed in all women, but mainly just a PAP in women under 30. And then,
Mm-hmm.
there's also the HPV tests. So I think there's a lot of confusion about what's a pap test, what's an HPV test. They're both collected at the same time with the same exam, but depending on a woman's age and risk factors, she may only have a pap or she may have a pap and an HPV test. And HPV is human papillomavirus. It's the virus that causes cervical precancers, cancers, genital warts, head and neck cancers, all kinds of things. And so by looking for that, we can go a little bit longer in intervals between pap smears and HPV tests.
Got it. So I'm gonna break it down. So what you're saying is when you go have an exam, pelvic exam with hands or a speculum exam, so the speculum exam when they're actually inserting, you can collect lots of different things. So the speculum exam can allow us to look for pap smear specifically, which is the cells of the cervix, so looking for pre-cancer screening. It can also check for HPV, which is a separate swab. And then it can also check for STDs,
Right. So,
right, as
yeah,
well?
that's a great breakdown. So, basically, with the speculum exam, we can get all of that information. So, if we put the speculum in, we visualize the cervix. We can take brushing from the cervix that we send off, where they will look at the cervical cells, do the pap smear. They can check for HPV from that same sample. And we can also do testing like gonorrhea, chlamydia, trichomonas testing at the same time from the vagina or the cervix. And that can be sent off.
So, ladies, if you are having a speculum exam, you want to understand what exactly it is that the doctor's collecting. And, I have to be honest with you, Susie, from the time that I trained back in the like mid 2000s till now, the screening recommendations have changed pretty significantly and they can be pretty confusing. Can you break it down for us, just like broad strokes without going into the nitty gritty, just broad strokes, what women
Right.
should know?
So, first of all, the American College of OBGYN recommends an annual gynecologic exam. So, a yearly exam with your doctor, you get a breast exam, you get a pelvic exam, and you can talk about ways to optimize your health at that time. So, we still would like to be seeing women every year if possible because stuff can come up in between pap smear screening intervals. And like you said, there have been a ton of changes. So instead of getting a yearly PAP, we go longer intervals. But we basically break the guidelines down by age. So we generally don't start doing pap smears until age 21, but we may still see someone in our clinic for other issues and may not need to do an exam. So there's always that fear that, oh, if I go to the gynecologist, I'm going to get an exam, but that's not true. So over 21, generally we do just a pap only. So we put the speculum in, we collect the pap, we don't check for HPV because a lot of women between 21 and 29 are going to test positive for HPV, but they're going to be very low risk for cervical precancer or cancer. Between 30 and 65, there are a number of things that you can do that are recommended. So most of us are doing pap smears with high-risk HPV tests. That means we are looking at the cells of the cervix, and we are also testing for the most risky virus types of HPV that can cause cervical cancer. And then we're generally doing that everywhere between 3 and 5 years. So the official recommendation is 5 years. I know there are still a lot of physicians doing 3 years intervals, but the official ACOG recommendation is 5 years. And then it's also acceptable in the women between 30 and 65 to do a PAP, just a PAP every 3 years, or just an HPV test every 5 years. There are a lot of nuances, and honestly, a lot of times I get patients, they have abnormals. I'm on the app trying to figure out, okay, what's the recommendation? And then I'm discussing with the patient, what are we comfortable with? So.
Right. Right. And I love, so two takeaways that well, a couple takeaways. So number one, regardless of what the recommendations are, you should be seeing your doctor once a year. And I think that was really confusing to women. Like, oh, so I'm good. I don't have to see a doctor for 3 or 4 years now. No, no, no. You still want to be getting your annual checkup. So I'm really glad you said that. The second thing is that you really want to make sure that you understand and you're talking to your doctor, okay, so it came back abnormal. What does that mean? and what are my options, right? Because I think sometimes patients don't really understand, or they maybe opt for more aggressive treatment than is necessary. So really having a good handle and talking to your doctor. And then the third thing is that the bulk of women of reproductive age, 30 to 65, that's a big age range. So those women, there's a couple different options, but you can either do every 3 years or every 5 years, depending on what is being looked
Right,
at.
right. Yeah, and
Does that
just
sound
to
about
highlight
right?
that yearly
Okay.
exam, especially in women, if they're considering their fertility or they're thinking about starting a family within a year or two, that's a really important time to mention things that they can do to optimize their health, as you know, making sure they're up to date on their vaccinations, talking about genetic testing, making sure that they know when to stop their birth control and getting on prenatal vitamins and things like that. So there's so many times in a woman's life where she can really benefit from just the information, and it's not always about the pap. And so we see our patients every year and then just try to tailor their visit to what's going on in their life. So
Yeah, I love that. That's okay. So I have a couple more questions for you. Number one is I get asked a lot about, the impact of birth control pills specifically, but I'll just kind of umbrella that under hormones in general. The use of birth control of any sort and the PAP result. Can you talk
right,
to us about
that's
that?
it's been confusing. So I think in women that use barrier contraceptives, they're going to be less at risk for acquiring an HPV infection. So women with hormonal contraceptives that don't use condoms would be higher risk for contracting HPV. There are some small studies I've seen that talk about maybe decreased risk of HPV with certain IUD types, like the copper IUD can cause some inflammation, and so maybe that may be somewhat protective. There's been some talk about maybe a higher risk of HPV with oral contraceptive pills through some kind of folic acid type metabolism, but I haven't ever seen anything really definitive to talk somebody into one or another type of birth control based on that alone. Yeah.
Purely based on that. But I never thought about it this way, and it makes so much sense that if you're using a hormone birth control, there's a good chance you're not using barrier contraception, in which case you're potentially at higher risk for
Right.
an HPV exposure. So I didn't even put two and two together, but that totally makes sense. The second question that I typically get is if I'm trying to get pregnant or I'm currently pregnant,
Oh,
is it
yes,
safe to get a pap
definitely. And
smear?
we do pap smears at the first pregnancy visit. And sometimes when there's an abnormal pap smear, if it's abnormal enough, we will still do external cervical biopsies during pregnancy, but we really try to avoid that if possible. But yeah, paps are not a big deal during
Got
pregnancy.
it. Got it. And then I'm curious about the
Mm.
pandemic. I want to talk a little bit about COVID. I feel like COVID marked all of our lives, certainly in the healthcare space. But we here on the fertility side, we shut down treatment for almost 2 months when the shutdown first happened, and then we were very slow to ramp back up. So and we noticed that patients, that some of them took 6 months, some of them took longer to return to care because people were trying to figure out, what was going to happen. On the annual screening side or on the general OBGYN side, what did you guys see? Were there any changes to
Oh,
patients coming
definitely.
in
I
for
think there were
screening?
definitely a lot of deferred screens because people just didn't want to come into the office. They didn't want to go to the doctor. And I think there's probably, we're probably still dealing with a little bit of a backlog with getting women in for their exams. Plus, pandemic time, it's hard to remember what year anything was. So if you thought you had a pap smear in 2018, it could have been 2015 because the last 3 years have felt like
Yeah.
6 years. So it's really hard to know. And that's
Yes.
the tough thing with those lengthened screening times. A woman says, oh, it was 5 years ago, but it's really hard to remember specifically. And a lot of women will get that annual reminder to come in. And then if they don't schedule it, they lose it and they can't remember how many years it's been since they've been in. So,
Yeah. And then my last question to you, and sort of in the same vein of the hormone birth control as women approach menopause and perimenopause. I think there is this idea that, okay, now I'm menopausal, now I don't need PAPs anymore. You mentioned that the age range is up until 65. So can you talk to us a little bit about what happens as women enter that perimenopausal transition and what impact that may or may not have to their pap smear
Right.
results?
So perimenopausal and menopausal women, I feel still, it depends on the woman. So they should still be coming in every year to discuss what routine health screens they need. And, women over 65, I feel, get kind of a bad brunt of things. It's not like at 65 you're not going to get cervical cancer. In fact, 20% of cervical cancers are in women over 65. But the thought is that if a woman has reached 65, she's been adequately screened with normal pap smears, HPV tests in the last decade or two before she hits 65, then she may not need a pap smear. And certainly if a woman has had a hysterectomy and has had all normal pap smears, she probably really doesn't need to have a pap smear. There are some nuances to that. So if she's got risk factors, but the tough thing is a lot of women in the 60s or 70s now may not have been getting a lot of HPV tests because that was newer technology that came out in the late 90s, early 2000s. So I really talk to my patients about what they want to do for screening because 65-year-olds are living longer and longer, are at what women's average life expectancy is mid 80s. So they may have new sexual
Yeah.
partners. They may think that they've been adequately screened, but really not been adequately screened. So,
Yeah. So lots of changes in that age range. I do want to talk about, there's a question that came up regarding removal of the uterus. The medical term for that is hysterectomy. And I want to talk
mhm.
about that in the premenopausal patient because that's the bulk of women that I see. And I will typically see those women post hysterectomy coming to me wanting to build their family. And so really we're not focused on the cervical cancer screening per se, but what are the general guidelines for those
So they're
women?
young women that have had a hysterectomy. Okay. Okay.
For a different reason. So, insert, let's say, fibroids or
Right, right. Yeah.
abnormal bleeding that failed medical treatment or whatnot. So now I'm seeing them to create embryos that would then be used for a surrogate. But what would their
Right. Well,
cancer screening look like?
technically, if they've been well screened without a cervix, they wouldn't necessarily have to have a pap smear. But as a gynecologist, I have a really hard time telling a 30-year-old to never have a pap smear again because cervical cancers and vaginal cancers are pretty rare, but I've had a number of women who have had some abnormal paps who have had to have vaginal treatments for vaginal precancers that have developed. So I have a hard time saying you're 30, we're not going to screen you for the next 50 years. So I would still personally screen that patient with a PAP and an HPV test, but I wouldn't go crazy doing it every year or 3 years. I probably would put her on a
Got
5-year
it.
schedule, but I would still do an exam because she has
Plan.
ovaries and
Got it.
she needs a breast exam and things like that.
Yeah. And I think the number one, probably biggest takeaway message from my interview with you today is that annual visit. Regardless of what the 3-year, 5-year age, etc., you really want to be seeing your doctor once
Yes,
a year.
yes.
Period.
I totally agree. And there is that the concept of the shared decision making. So I have some patients that I tell them you don't need a pap smear. We did a pap and an HPV test 2 years ago, and they just really want it done. And I feel like it's not
Mm-hmm.
that invasive, it's not that expensive, and sometimes you catch things. It's crazy. So when guidelines are meant for
Mm-hmm.
a broad
Mm-hmm.
range of women, and then you really have to tailor it. And sometimes people fall outside of the guidelines.
Taylor.
So.
Yeah, I love that. I love that shared decision making concept. So, Dr. Weber, tell us, where can people find you? Where can
Right.
they
So as
work
I
with you?
mentioned, I have a practice in the South Denver metro area if somebody's local. And then I blog and offer menopause consulting and coaching through my web page, healthiermenopause.com, and then Healthier Menopause on Instagram. So,
Healthiermenopause.com. I love that. So, guys, go check her out. If you are in the South Denver area, make sure to look her up. There was one last question that popped up about endometriosis. During the month of March, I'll be talking all about endometriosis. It is Endometriosis Awareness Month in March. So make sure to sign up for my newsletter, stick here on Instagram. And then if not, you can always go to ASRM, the American Society for Reproductive Medicine. They have a whole patient portal with lots of good vetted information regarding endometriosis. Dr. Weber, thank you so much for your
Thank you,
time
Dr.
today. This was
Swaldo.
wonderful.
Appreciate it. Bye. Take care.
Bye-bye now.